What are the options for having a baby in the future if a woman's fertility is affected by AML treatment?
If they go through treatments that can impact fertility, there are two ways that we generally preserve eggs, ovarian tissue. One is by egg retrieval. So these are mature eggs that we freeze. And the second is ovarian tissue. In terms of the mature eggs, you have an option of freezing the mature egg itself. So in the future, if the patient is not fertile, you can have a donor or your partner, husband, you do sort of like an IVF. So you do an in vitro fertilization and implantation because the uterus is not affected. You can carry a baby, you just don't have ovarian tissue that is making eggs that can be fertilized. So that's one option. The other option when you have an egg that is donated is that if you have a husband, a partner that wishes to fertilize at that moment, you can make an embryo immediately once the egg is harvested and you freeze the embryo. The chances of successful fertility with a frozen embryo is the highest compared to a frozen egg. But that may or may not be relevant at that time because it's difficult. You may not have a partner, or you're not thinking yet of having any children. If this is something you're thinking of 10 years down the line, then you just freeze the egg. The other option is, if a patient or a woman cannot donate an egg because the disease was too aggressive, the chemotherapy had to be started right away, and then they're in remission, and just before going into transplant is also a moment where you can consider ovarian tissue preservation. So that's where they take a part of your ovary and they freeze it. Now that is something that is not always guaranteed to give you fertility down the line, but this whole field of reproductive endocrinology is advancing so rapidly that it's possible that even that tissue in the future might be able to give rise to mature eggs that would fertilize. But right now, that concept is we're doing it for future use. We don't have yet a successful way of guaranteeing fertility in somebody who has ovarian tissue preserved compared to what I said earlier, where the mature egg or the embryo is preserved.